Okay, we're going to go ahead and get started. Hello, Mr. Smith. Welcome to the emergency center. You don't look so good. You look like you're not feeling good at all. I see on your chart that you have a low blood pressure and a fever. I think you might have sepsis. What is sepsis? Well, it's a condition that occurs when your body has an infection, and when it does go untreated, you can have adverse consequences on the organs in all of your body. Let's go through some of these so you can better understand. Let's talk about the white blood cell count first. When the body is not infected, the white blood cell count can be anywhere from 4 to 12. They go on their daily activity like there's no concern at all. An infection is like an alien, and your body acts like an army to fight this alien in your body. So when the white count is elevated in your chart or on the computer here, it looks like you have an infection. However, in cancer patients that receive chemotherapy or even have cancer itself can decrease the white blood cell count. When the body is infected, the defense system is down and the infection can become serious very quickly. Now we will talk about what happens to your heart rate and your blood pressure. When your body is not infected, the veins stay at a normal size and the heart beats at a normal pace, delivers blood normally, just like this. When your body gets an infection, your veins can become dilated or get bigger. You see what happens when the veins get bigger? The heart has to work harder, and there's more blood that needs to pump through the body. Think about it this way. If you have a regular straw, it takes a small amount of fluid to get through that regular straw. However, if you have a huge straw, it takes a lot of fluid to get there. You see how fast the heart is working? If this is happening, doctors may prescribe a medication called vasopressors along with fluids. This helps the veins to reconstrict. Once the veins have gone back to normal, the heart usually slows back down and becomes now easy to work with. Let's talk about how sepsis affects our brain. When the veins get bigger, the blood decreases to the brain.
Discrete, indivisible units of energy called quanta, as described by the quantum theory of randomium. What theory? Where's my toothbrush?
As you can see, they become altered and confused. So now let's talk about the skin. When the blood is flowing to the skin, it looks pink and feels warm to the touch. When the body has an infection and the vein starts to dilate, the body tells the blood to go to major organs, such as your heart and your brain. Because of your hands and your feet don't get enough blood flow, they get very cold and actually turn purple at times. One test you can do is called a capillary refill time. You can hold your hand above your head or above your heart, press down on one finger until it turns white, and then count the number of seconds it takes to return back to normal. Usually this is less than 2 seconds.
1, 2, 3, 4. Uh-oh, that's not good.
You can also see skin modeling, which is the skin changing colors, or it becomes patchy as presented up here. Next, we will talk about the kidneys. When an infection causes the veins to get busy or bigger and busy, usually the body holds on to excessive fluid. It's important to always note the change in the urine output.
Look at mine, nice and normal. Oh no, my body's trying to help me out, so I have no urine.
Finally, we'll talk about what happens to the bilirubin, or liver. When your liver doesn't get enough blood flow, it eliminates a substance called bilirubin.
Hey y'all, my name's Billy. Billy Rubin. What? You're trying to get rid of me? I just got here. Hey,
As the bilirubin builds up in the body, your skin actually turns yellow and your eyes can turn yellow.
That's better. You look much better now. Let's go to the party.
Well, Mr. Smith, that is what happens inside your body if we don't get your sepsis treated. Right now, you look okay, so I'm going to go ahead and give you IV fluids and then get your antibiotics started quickly. That's the end.